Today, October 31st, is a special day for us in the San Francisco Department of Health, as it marks the end of the San Francisco Department of Health MPX response. And I am here speaking with Frank Strona, who is a CDC field assignee supporting the San Francisco Department of Health and assigned for many years supporting disease intervention and special projects for the San Francisco Department of Health. Frank served as the lead for the MPX response, and he is here to answer a few questions about his experiences in the response. So Frank, what are you most proud of in the way San Francisco Department of Health responded to MPX?
Thanks, Ricardo. They're great questions. And when Susan Phillip, our director, asked me to step on as the incident commander for monkeypox, it was definitely an aha moment on many levels. And what my initial response of what it would be like, what was I going to be able to bring to this at that senior role of what was then an incredibly complex, scary, lack of information time for the country as well as locally. But I think in the end, now looking back since July, I think I'm proud of many things. I'm probably the most proud of that San Francisco and our health department took action. We were one of the first locations that declared this an emergency, no matter what our colleagues across the country. And there were pushback from folks who didn't think it needed to be done, but we did it anyhow. We got the buy-in all the way up the food chain in order to recognize that this was affecting a strong amount of the population in San Francisco, and what we needed to do. And I think equally as important, and it was relevant and rolled out in all of our work and all of our effort, was that how we were going to approach this was also to make sure that we did not fall victim to shaming messaging, stigma, and fear. It was paramount that at our inner core working, San Francisco would make sure that we would be creating a safe experience for those who needed to be cared for, who needed to get vaccination, and that our materials and our messaging was on point, that this was not a shameful or stigmatizing activity. And then I think the most exciting thing for me today is we are moving into, and very soon we'll have hit our 50,000th vaccine. So I think I'm incredibly proud on this very rapid and agile experience.
Yes, congratulations on that milestone of the 50,000 vaccines administered. That's fantastic.
Right around the corner.
Right. That's fantastic. Have you learned anything new about the community during the MPX response?
I've been working in the community and the networks of San Francisco for almost 30 years. So, and they've been very diverse. I've been able to participate in many different network and many different environments. So did I learn anything new? I don't think so. What I was reminded in an incredibly pleasant way was how resilient people are when they're invited to the table to take part and be active collaborators in our public health. This is something traditionally San Francisco has done. We've done it with HIV, we've done it with syphilis, we've done it with other health conditions. We bring the lived experiences, the collaborators from both the public and private sector into our tools of public health, and they become key components of how we offer preventative and health services. So I think that reminder that our process works was great, was that our collaborations, some of which we've had collaborations with long-term partners, were ready to stand up and help, whether it be the San Francisco AIDS Foundation or Kaiser or UC or some of our clinics that traditionally are already overwhelmed. They were willing to step up and help us do this effort.
Thank you. And what lessons do you think SFDPH should take away from the MPX outbreak?
Well, I'm not a clinician, so I think my bias is from that perspective. I think one of our best lessons learned was we have to look at previous experiences, make corrections, make active solutions that we got caught now with monkeypox. We saw that there was going to be some lessons learned that from COVID we hadn't really picked up on yet. So one of them is that. And I think the other element is really to ensure that we are grounded in the core missions of our programs, that we're guided by both science and people's needs, with an understanding that is embedded that the stories behind the data help us find hidden gaps. It helps us make sure we're not making judgments and policies and protocols that are founded on a misconception, and that we equally explore those stories with the same vigor as we review the data.
Thank you, Frank. And the final question is, do you have any advice to share with people that want to be in public health response leadership positions?
Yes, do it. Jump in. Do a really good self-assessment of what your assets are. Make sure you can, it's very different. It's not like you want to put a resume forward. You need to synthesize in very salient points. Here are some hidden assets that I have that maybe fall outside of my job normally that I could bring to this response, and then present it. Don't always assume, and I think we know this in San Francisco, that just having a type of degree does not make you better in some cases. So our response, when we look at it, we have social workers, we have clinical teams, we have nurses and doctors, we have, but we also have non-medical teams. We have health education specialists, we have health specialists, we have people like you and I who are public health advisors, we have communications experts. So understanding that this is a true essence of it takes a village in order to get to this point. And we can't make that assumption that only the clinicians have the power to understand community, because oftentimes clinicians, in order to do what they do best, and some of our scientists and our EPIs and other folks, they don't get into the community at an on-the-ground level. It is actually these other people and our other career colleagues who are in those communities every single day, working and hearing. So the value, again, and it kind of speaks to what lessons learned is, we have to marry our data with the stories, with the experiences, and then evaluate them all together. So I think the advice is, if you're coming from that community, if you have a lived life experience, assess it, see what you can bring, and then bring it forward to the appropriate leads and say, I would like to do this. And, of course, if you're in the health department, you want to make sure that you have gotten clearance from your boss to have these conversations, because that's always important. But I really think is repackage and self-assess.
Thank you, Frank. And with that, we conclude our interview. Thank you for your service, and thank you for taking the time to meet with me today.
Thank you. And it just has been a great experience. Thank you.